Dr. Ramesar here, who I think spent quite a bit of time researching and actually going into test labs to test the goods that were confiscated. So, Shamal, do you want to take us through that process of your test and scientific test of the confiscated goods, and what did you find in the confiscated illicit alcohol?
Thanks, Norma. So, what we did last year was we took quite a few samples from confiscated liquor and subjected it to two different types of tests in a laboratory in the University of KwaZulu-Natal. And the results were quite horrifying because one of the most prominent chemicals that we were picking up in most of the bottles that were tested was methanol. Now, for those of you that remember late last year, it made the headlines. There were two cases, independent cases, where there was a South African artist who was on tour in Vietnam, who drank alcohol laced with methanol and unfortunately demised. I think a month before that, there was also in the headlines a group of lawyers, young lawyers who were in Laos, who were taking shots that were laced with methanol, and they also died. So, if methanol is what we're finding in our counterfeit products, then it shows the seriousness of what we're dealing with here. For those of you that understand or want to understand the physiology, methanol can cause irreversible blindness. It can cause metabolic disorders, what we call metabolic acidosis, which leads to multiple organ failure and then, of course, death. In the studies that Benjamin showed now, we're also seeing industrial scale ethanol that's been used to counterfeit, many of the white spirits, especially because it's so easy to mimic. And industrial scale ethanol has respiratory effects on the body, so it depresses the respiratory system, causes blood thinning, and so on. All of which ultimately leads to serious health concerns. So I get quite scared when I find that counterfeit is now taken over as the number one type of illicit alcohol in South Africa, purely because we're seeing that the chemicals that are being used in them are quite deleterious to human health. But what is interesting from the research is that 83% of the consumers know that when they purchase counterfeit alcohol, it's going to cause some sort of health concern. In fact, 49% of the consumer or the surveyed respondents said that they know of somebody that had a serious health effect or alcohol-related harm that was direct result of illicit or counterfeit alcohol. And the most scary one was 29%. That's 1 in 3 respondents know of somebody who has actually died from consuming counterfeit alcohol. And that shows you the extent of the problem that we face here.
Yeah. So, Doc, are you saying that really bad hangover after a long club hop on the weekend may actually be some ethanol in your body?
It could actually be a very short scene at the nightclub because the studies show that even 1 or 2 drinks that are laced with methanol or even ethanol, sometimes acetone, can cause really bad headaches, dehydration, blood thickening. So those are the issues that we're starting to see.
Yeah, that's a stark reality because I guess a lot of people complain about these long hangovers after a long club evening. Is there a case to be made about restrictions or stricter regulation about how we distribute the actual component of methanol and ethanol?
So I think strides are being taken in terms of monitoring ethanol movement and methanol movement through SARS and the likes.
Okay.
Unfortunately, we do have a problem with our borders. We have porous borders, which allows these massive orders of ethanol to come in from other countries. And that's really where we're starting to see the sophistication of these manufacturers or illegal manufacturers, because they have industrial scale facilities now that are producing these bottles, hundreds and thousands of them, at a given time, and that sophistication is what's leading to us seeing these products even in the formal retail sector.
Okay.
So there are strides being made, and I know Benjamin's mentioned it in the report, where SARS, for example, is monitoring ethanol movement. And methanol movement, but unfortunately smuggling is the issue here.
That's the issue here.